Dry socket, what is it? So, exodontia, tooth comes out, socket fills with blood, blood clot starts the healing process. If that blood clot is broken down or lost too soon, then you get a dry socket, pretty much what it says on the tin. Who's at risk of this? Females who take the oral contraceptive pill, difficult extractions, usually extractions in the mandible versus the maxilla, but not exclusively. More complex extractions, inexperienced operators, patients who smoke or who have multiple comorbidities, and also patients who've had a dry socket before, they quite often are susceptible to another dry socket. So, symptoms, patients usually come back in the first 3 or 4 days with pain, well-localised pain to the socket that's not getting better with painkillers such as paracetamol or ibuprofen. There is no lymphadenopathy, there is no temperature. Dry socket is self-limiting, so generally it will get better on its own. However, this pain is quite unbearable. So you see them, examine them, look inside, you will see that the socket is raw, open, nothing in there other than bone, very uncomfortable. You need to wash that socket out with saline, and you can use one of these syringes called a Monoject syringe, which is really good. It's got a soft tip on the end. Irrigate the socket and pack it with Alveolar. Alveolar has a bit of steroid in it, a bit of analgesic, and also a little bit of an antimicrobial, and that will sort things out. Just gently pack it so there's a little bit in there, and they will get relief quite quickly with that. Tell them not to rinse for a couple of hours. They may need to come back the next day to have it repacked. If you're packing it 2 or 3 times, the chances are your diagnosis is wrong and it's not a dry socket. Remember, a non-healing socket is suspicious. Hope that helps. Remember, dry socket, aka alveolar osteitis.